Okay, so we are looking at another modality which we can use towards diagnosing pleural effusion. So this is what is known as pleural biopsy. Alright, so look at pleural biopsy, how it is done, the indications, when you need to do it. Alright, so just have to do it. What you are putting the needle in to pick up some tissues so that I can send to the lab and know the real problem. Okay, so percutaneous pleural biopsy is a minimal invasive procedure. Is used to diagnose the cause of pleural effusion, which is the abnormal accumulation of fluid in the pleural space surrounding the lungs. Right. So what it is? A needle biopsy performed through the skin is percutaneous. That's like through the skin. Okay. You obtain a small sample of the pleura, that's the membrane lining of the lungs and the chest. So typically it is done under local anesthesia because you are invading somebody, there will be so much pain, right? So often guided by ultrasound or CT imaging to ensure accuracy. When is it indicated? So when pleural effusion is unexplained. Alright, so when it is unexplained. Okay, also you can do this to investigate suspected diseases like infections like tuberculosis, maybe some cancers have been the ones that have caused the pleural effusions, you understand, or inflammatory diseases. Especially it is useful when thoracoscopy is not available or not feasible. Okay, so how is it done? The patient is usually seated upright. Got the picture here. So usually seated upright, then a biopsy needle is now inserted between the ribs into the pleural space. That's the Abrams or the Coop's needle. Multiple samples, so usually 3 or more, are taken from different angles. A chest X-ray is often done afterwards because you want to now check for any complications like pneumothorax. When you were doing it, were there any complications of air there? So risks and consideration is pneumothorax can lead to collapsed lungs, can lead to bleeding or infection, can lead to pain at the biopsy site. Not recommended for patients with bleeding disorders or local infections at the biopsy site.